Hello everyone, I'm back. I think I had some technical difficulties. I think I lost my connection, but we're going to try this again. It's Saturday morning and we're not going to let anything stop us. So I am just waiting for a couple people to join us again, but if not, I understand people have things to do. I just dropped off my son to music lessons and I am here coming to you with a hot topic. So I'm going to just get started. My name is DrKelenne. I'm a board-certified family medicine physician, and I help busy Caribbean professionals achieve optimal health on the go. So today's topic is high blood pressure, otherwise known as hypertension, and it's a silent killer. Many of us between the ages of 30 to 50 have high blood pressure and we don't know it because it's silent. You don't have any signs or symptoms about it, and I'm here to let you know what high blood pressure is and how to identify it. So what is high blood pressure? High blood pressure is the amount of blood it takes your heart to pump, and it's also the amount of resistance it takes to get blood through your blood vessels, more specifically your arteries. Blood pressure is ideally supposed to be 120/80. If your blood pressure is between 120 to 129/80, it is considered borderline. Stage 1 high blood pressure is between 130 to 139/80 to 89. Stage 2 blood pressure is anything over 140/90. So when I say 140/90, the top number is your systolic blood pressure. That's the amount of pressure it takes to get blood out of your heart. The diastolic blood pressure is the bottom number, the amount of pressure it takes to get blood into the heart. And so high blood pressure is something that develops over time. So what causes high blood pressure? There are two types of blood pressure. There's primary benign essential high blood pressure, which means there's no identifiable cause. The doctor has searched for everything and they haven't found anything to trigger it. Mostly this is because of your lifestyle and dietary changes. Then there's secondary high blood pressure. That is identifying a cause. And once you treat the cause, usually the blood pressure resolves. So examples of secondary high blood pressure would be obstructive sleep apnea. Those are the people that sleep with a face mask. Then there is chronic kidney disease. There are adrenal gland tumors. The adrenal gland sits on top of the kidneys and it's responsible for a lot of different hormones in our body. And if there's a tumor there, that can technically cause you to have high blood pressure. Having thyroid problems can also cause high blood pressure. Over-the-counter medications like Mucinex and Robitussin, taking too much of these things can also increase your blood pressure. Decongestants, anything that says D, like Mucinex D, Robitussin D, the decongestant portion of it can trigger high blood pressure. That's why it's always important to check with your physician to see if you can take those medications. Over-the-counter pain relievers like BC powders or medications like Excedrin migraine. Those things can also trigger high blood pressure. And also taking illegal drugs like cocaine or amphetamines, or even having pain or trauma. If you just got in a car accident, it's natural for your blood pressure to go up, but that's usually temporary. You can also, if you had surgery or broke a bone, your blood pressure will go up temporarily. Hey Tanisha, thanks for joining me again. Had some technical difficulties. So what are the risk factors, or actually what are the signs and symptoms of high blood pressure? Well, unfortunately, most people don't have any, and that's why it's a silent killer. You don't feel anything. You go to the doctor and they check your blood pressure and they say, oh, wow, your blood pressure is high today. It's 150/90. And you're like, why? I don't feel anything. I feel fine. I feel normal. And that's typically the case. And it can go like that for years until it's too late. If you're feeling symptoms, sometimes it is a little too late. Well, other signs of high blood pressure include having headaches daily, having some blurry vision, having chest pain, shortness of breath, feeling fatigued or lethargic. These are all signs of high blood pressure. It doesn't necessarily mean that's the only cause, because all of these are vague symptoms, but you should get checked out. So what are some risk factors for high blood pressure? Well, for men before the age of 64, you are more predisposed to having high blood pressure. And usually for women over the age of 65, that's typically when they develop high blood pressure. However, race is a factor. In people of African descent, we typically develop high blood pressure at a younger age. And usually it's more detrimental because we develop more complications such as chronic kidney disease, heart disease, strokes, or more serious complications from the disease. And that's why if you know that you have a family history of high blood pressure, it's even more imperative that you start to take action now in terms of changing your lifestyle and your habits. Obesity and being overweight are also predisposing factors for high blood pressure. When you're overweight, it takes a lot more blood to circulate in your body to carry the nutrients that you need, such as oxygen and all the nutrients that you get from your diet. And it takes a lot more pressure to get that blood flow from your heart to the surface of your skin, and that causes damage to the walls of the arteries. And that's why it's imperative that you get your blood pressure checked and lose some weight. Sedentary lifestyles increase your heart rate. A higher heart rate actually affects your blood, the walls of the blood vessels, and it causes your blood pressure to go up. Tobacco is a big one. Tobacco has nicotine in it, and nicotine causes vasoconstriction, meaning that it narrows the blood vessel. And when it narrows the blood vessel, it takes a lot more pressure to get that blood through the body. Think of it as a pipe. If your pipe is open and it's flowing, there's no backup of pressure. But once it gets clogged, everything backs up in the system, and then you have to plunge it out, and it takes a lot of pressure to force that through. And so that's essentially how the heart works. The heart is a pump, and it pumps blood throughout your body, and if there's resistance, it's going to have to work harder. Sodium in your diet. Sodium makes you retain fluid, and if you retain fluid, that means there's more blood flow, and it increases the blood pressure. Now, a lot of people don't know that you need potassium in your diet to kind of help regulate your sodium. Potassium balances the sodium in your cells. And if you don't have enough potassium, then you build up your sodium, and that makes you retain more fluid. Drinking a lot of alcohol. I know many of us like to have a drink or two. It's recommended that for women, we have 1 drink a day, and for men to not have more than 2 drinks a day. And a drink is considered a 12-ounce can of beer, a 5-ounce glass of wine, or 1.5 ounces of 80 proof liquor. Nothing more than that, not 150 proof, 80 proof liquor. And so having only 1 of those a day will reduce your symptoms. Stress is something that is huge in many of our lives, and learning how to reduce our stress can also help us reduce our blood pressure. Good morning, everybody. Good morning, Dwayne. Good morning, Felicia. Thank you for joining me today. We're talking about high blood pressure and just the basics of it, and how it can affect your body, and how it's a silent killer. So by decreasing stress in our lives, that can also help to lower your blood pressure. So meditating, taking a walk, listening to good comedy, something to decrease the stress in your life will also help to lower your blood pressure. Stress can be temporary, but if you're someone that gets anxious and nervous a lot, it can also trigger your high blood pressure. Chronic diseases such as kidney disease, diabetes, obstructive sleep apnea also predisposes you to high blood pressure. For our younger women who get pregnant, sometimes during pregnancy you can develop high blood pressure, and that can resolve after the pregnancy, and that's because of, yes, Tanisha, stress is a silent killer, so you need to get out there and start figuring out a way to de-stress. But for pregnancy, sometimes the blood pressure can go back to normal once you have had your baby. That's because you have a whole lot more blood circulating and a lot more fluid circulating. But it does put you at a higher risk for developing blood pressure later on in life. children can develop high blood pressure. Most of the time it's because of some congenital heart disease or congenital kidney disease. However, nowadays with our poor lifestyle habits and not eating properly and kids not exercising or playing sports and going outside as much as they used to, they are actually developing high blood pressure at a younger age. And kids learn habits from their parents. So if you don't teach your kids to eat healthier, eat their fruits and vegetables, and not to go to McDonald's or Hardee's or Chick-fil-A all the time, then they will not learn these habits from now, and they will have more complications later on in life. So it's important that you teach your children how to eat properly, drinking more water, staying away from sodas. Those things will also help them. So now we're going to talk about the complications of high blood pressure. High blood pressure, like I said, is a silent killer. It can lead to heart attacks. Heart attacks usually, for the most part, some people may feel a heaviness or pressure in the middle of their chest. Sometimes it can radiate into their shoulder or down their left arm or into their neck. And if you have these symptoms for more than 30 minutes, definitely go to the emergency room and see a doctor. High blood pressure can also lead to aneurysms. Aneurysms essentially are when the walls of the blood vessels get weaker and they tend to expand and they can rupture. So you may have heard of people getting a brain aneurysm or an abdominal aortic aneurysm. Essentially what happens, those blood vessels in the brain and in your stomach weaken and they can rupture, and that is deadly. Sometimes you can catch it earlier, and especially people who smoke, they're more predisposed to having aneurysms. So it's important that you get checked. Chronic kidney disease. I have too many patients that are under the age of 40 on dialysis because of high blood pressure, especially in the African American community. It is important that you watch your diet and exercise and get checked. Vision loss. So you have blood vessels all over your body, including your eyes. And when the pressure builds up inside of your eyes, you can develop what's called glaucoma. You can also get retinal detachments, and you can go blind. So all of these things can contribute to complications if you do not take care of your high blood pressure. Good morning, Dr. Lamont. Thank you for joining me. There's also something called dementia, and I'm not talking about Alzheimer's dementia where you just get forgetful. There's something called vascular dementia. That's where the blood pressure gets so high in the brain that the little small tiny blood vessels start to get leaky, and it loses its connection where you can have memories form. And so you start to develop loss of memory because of high blood pressure. It's similar to Alzheimer's, but it's because of the high blood pressure that you're losing your memory. So it's important that you go and get screened. If you do not have money to go to the doctor, you can go to your local pharmacy and get your blood pressure checked. And a normal blood pressure is 120/80. Anything over that, you're either borderline or having high blood pressure, and you should see a physician and get checked. Hopefully this saves someone's life, and you can share the message. Comment below if you like this, if there's any more topics that you want me to discuss. I'm Dr. Kelenne Tuitt, your board-certified family medicine physician, and I help busy Caribbean professionals achieve optimal health on the go. You can follow me on all social media at Dr. Kelenne, DrKelenne. Cheers to life. I hope you guys have a wonderful weekend. Thank you for watching, and take care. Share the video. Bye.